Welcome to DermTube Daily Coverage at Maui Derm 2015. I'm Joel Cohen, and with us today is Dr. Albert Yan, who is Director of Pediatric Dermatology at the University of Pennsylvania and Children's Hospital of Philadelphia. Dr. Yan, I know you spoke here about some very relevant topics for kids that we see on a regular basis. Preadolescent acne is something that I'm grappling with as a dermatologist and as a parent, even married to a pediatrician. So how do you really approach talking to these parents about what their kids are going through, and talk us about your treatment regimen?
Well, the issue about acne in preadolescence sometimes comes up because it's brought up by the clinician rather than the child, because they may not really see a lot of pimples yet, and it becomes more of an issue as they start to notice it blossoming. Once they do start to care about it, I think it's an issue of getting them motivated to do the treatment. Fortunately for preadolescent acne, it's a condition that's mostly comedonal. It's that typical T-zone distribution that we commonly see along the forehead and the central face, and it usually responds quite well to off-label use of benzoyl peroxides and topical retinoids. Now, in my practice, a lot of the kids come in already having tried things when they're motivated to treat. They'll use a variety of over-the-counter products. They've probably been through several, half a dozen or more, and they want some additional help to move things along.
So how do you really build the confidence in the child to use these products, which we know benzoyl peroxides and retinoids can be very irritating? So how do you start them on? Do you start every third day and kind of gradually increase things, or do you have some secret to help moisturize their skin so they can really tolerate this?
Sounds like you know my secret already. I do think that I take usually one of two approaches with the kids to kind of condition them to those treatments. For those kids who don't want to be using something every day, I think every 2 to 3 day approach for the first week or two works great. For other kids who have trouble kind of figuring out which days of the week it is, because they're so busy with so many other things, I like the short contact approach, which actually has a lot of data to support its effectiveness, where I have them apply a medicine that's potentially irritating. They leave it on for between half an hour to an hour at night, and they wash it off, and they do that for a period of a week or two. Once they're used to using it and are accustomed to how it feels, their skin's often conditioned to the point where they're not irritated anymore. They can use it on a regular basis thereafter. And the other thing that's helpful is I oftentimes have them combine it with a topical moisturizer when they're using their treatments, because I don't find that that's likely to interfere with the effectiveness.
Those are great and helpful tips that I think we can all employ in our practices. I think we see a lot of parents out there who have misperceptions about retinoids topically and sun exposure. So how do you help clear those up when you're having these discussions?
Well, I try to address what they're actually concerned about. In some cases, I think they're worried that it's going to make them exquisitely sun sensitive, that they're going to put it on, go out and get sunburned. And obviously that's not something that I think they need to worry so much about if they use the medicines properly. I try to explain to them that the medications are designed to really unclog those pores, to thin out that dead layer of skin, and in the process, that may make them a little more sun sensitive to sunburning a little more easily, but if they're diligent about using sunscreen and sun protection when they go out, the way they should be smart about doing anyway, they can oftentimes avoid the complications of getting sunburned. And for most families, I think that works well.
I think it's similar to my approach. I think the sun makes folks dry, and hopefully we're sun protecting them, but retinoids topically can dry folks out as well, and it's really the fact that they're inactivated by light, which is why generally we use things, with the exception of adapalene at night, that is something that they don't quite understand. So you also spoke about hair disorders in children, and that's a very specific and subspecialized topic that not everybody sees in their daily practice, but one of the interesting things you spoke about was the use of a dermatoscope to help in diagnosis of hair disorders in kids, and I know that's a blossoming field. Can you tell us a little bit about this?
Well, I think it's a really exciting area because we're now using dermoscopy pretty regularly for pigmented skin lesions and In pediatrics, we'll use it for other types of skin lesions to help differentiate things. But for hair, it's a particularly exciting area because hair disorders, as you pointed out, can be a big black box. And I think we need all the help we can get when we're looking at pediatric hair problems. Where I find it useful is, if we talk about how hair dermoscopy or trichoscopy works, you're looking for the dot patterns to see whether or not there are black dots, white dots, yellow dots to kind of point you in a particular direction, what's happening to the hair follicles themselves. You want to see what's going on in between. Is there scaling, vascular changes, things like that that can be helpful. And you also, I think where it's really useful in pediatric hair analysis is when you have a hair shaft disorder. I see kids who have genetic skin disorders, and hair may be a feature of that. So the hair pattern can be very useful. In one case, I had a child who came in who had very funny-looking hair in that it was very twisted-looking. And when we used the dermatoscope on it, you could see that kind of twisting pattern to suggest pili-torti. And in concert with all of the other clinical features this child had, we were able to pinpoint a specific diagnosis on the basis of the initial hair findings.
Incredibly interesting. I carry a dermatoscope in my pocket every day for skin checks and marking out tumors, and saving the time between going back to the microscope to see if somebody on a hair pull test is an anagen or telogen. It seems that this field is just really spreading into multiple other areas, and we appreciate you sharing your experience.
My pleasure.
Thanks so much for joining us for another edition of DermTube Daily Coverage from Maui Derm.